The Deep End team acknowledges the traditional owners of the lands on which we work and live, pays respect to elders past, present and future, and recognises the importance of Indigenous knowledge to informing public debate. Welcome to The Deep End, hosted by Marcia Langton and Erin Corn. Today, we're interviewing the prolific Australian epidemiologist, Fiona Stanley. Fiona Stanley is an Australian epidemiologist noted for her public health work, her research into child and maternal health, as well as birth disorders such as cerebral palsy. She is the patron of the Telethon Kids Institute and a Distinguished Professorial Fellow in the School of Paediatrics and Childcare at the University of Western Australia. Her contributions to Indigenous Australian health have been nothing less than profound and contributed greatly to training a whole generation of Indigenous Australian health practitioners and professionals. From 1990 to 2011, she was founding director of Telethon Kids.
This is Marcia Langton, professor at the University of Melbourne and associate provost, and Professor Aaron Corn, director of the Indigenous Knowledge Institute. We're here on Wurundjeri and Bunurong country on the lands of the Kulin Nations at the wonderful Victorian College of the Arts. And today we are speaking to the wonderful Professor Fiona Stanley. So Fiona, you've been a paediatrician for many decades, a leader in the medical field, in epidemiology, in children and youth health and well-being. You've made an enormous contribution to Aboriginal health and well-being, or Aboriginal and Torres Strait Islander health and well-being, the Telethon Kids Institute, and so much more. So we're very delighted and honoured to be speaking to you. So my first question, Fiona, is please tell us how you feel about the referendum proposal that we will be voting on October 14.
Marcia and Aaron, thank you so much for having me. I'm absolutely honoured to be on a podcast that you're running. I'm on Noongar Budja, Whadjuk Noongar Budja in Western Australia. Always when I acknowledge country, I acknowledge the fact that it's never been ceded, and that I'd like to acknowledge that the stolen generations have an incredible intergenerational impact, which is still being felt today. So it's really important when I acknowledge which country I'm on, that I know and understand the data behind those removals and what they've meant. I should actually just correct you, Marcia, that I'm a failed paediatrician. I ran away from clinical paediatrics because I was working in Aboriginal populations and health in Western Australia as a young doctor when I was training at the Children's Hospital. And because these kids would come in with such severe medical problems from communities, and then we'd perform medical miracles on them and put them back in the communities where they lived, I said to myself, I can't do clinical paediatrics. I've got to find out why we can't prevent these kids from getting sick in the first place. So it was Aboriginal health that actually put me on this career path of prevention, public health, advocacy, social justice. And that was when I was a very young doctor back in 1970. I'm very old. But what the referendum means for me, I mean, I get goosebumps when I read the Uluru Statement, and I get goosebumps when I read the most beautiful Yunupingu comment about what Aboriginal people are asking of Australians with this document. I'm also extremely privileged to have had such a wonderful exposure and, I guess, really friendships and relationships with a large number of Aboriginal scholars and researchers and community people and elders and from all over, not just Western Australia. And so slowly I am starting to realise what Aboriginal knowledges are really about, and really the ways in which Aboriginal people have lived in the past, which have been almost totally destroyed by colonisation and the genocide of the stolen generation and the marginalisation, is very, very. I understand it. I've not lived it, but I have been often enough with these people to understand the profound effect it's had, as well as the fact that we've actually got some of the best data in the world on the impact of these colonisation practices on Aboriginal health and well-being and trajectories and pathways. So my excitement about this referendum is absolutely full. I could think of no better way for Australia now to stand up and say, this is going to be our nation deciding moment for acknowledging our history, because it is acknowledging our history that's so important, to actually acknowledge that, as Keating said, we were the people who took the children away. We were the people who massacred those people. And it was really important that we acknowledge that. And we won't be diminished by it. We will be actually better for it. So I believe in voice, treaty, truth-telling, and I do think that the best and only way forward is this voice. Has to be enshrined in the Constitution, because we know from all the data that I have on all of the government programs before, where, they had a bit of consultation or they perhaps had no consultation, they've been disastrous. They've wasted so much money. And they've sometimes been very traumatic, and I've got lots of examples of those if you want to ask me about them. But the point is that I know from the data we have, from the experiences that I've had, that having a voice to Parliament in the way that I think it could be developed, and I can see that it's working already in many ways, and we only have to sort of get the magic approval of the Constitution and the Australian people, and we'll be ready to rumble with lots of things. I think this is the most important and exciting thing that has happened to us, possibly in my lifetime.
So you're of an age, like myself, where you understand deeply how many things have gone wrong in the past for Aboriginal and Torres Strait Islander people, forced on us by ill will or by lack of thought. And you talked about some of the traumatic programs and policies, or programs and policies with traumatic outcomes for Indigenous people. Tell us about the one that sticks in your mind most.
Oh, thanks. I if I could make three parts to that answer, because there are ways. There are two big ways why successive governments have not closed the gap, and I'm going to give examples of that. But I want to go back to one of our first and big and most important studies, which was the WA Aboriginal Child Health Survey in Western Australia. And we did this in the early 2000s, and it was an extraordinary survey. There were 12,000 Aboriginal children and families that were interviewed with a nearly 90% response rate, Marcia. Now, you know how difficult it is to get people to respond to surveys, particularly as demanding as this. I mean, that's an extraordinary response rate. And, of course, it came with the responsibility of us then needing to put out data and recommendations that would change people's lives, because what the Aboriginal people in those communities, in the cities and the urban towns, were telling us were their stories of the dispossession, their stories of the removal, and how it was still affecting them. And we found that within those ATSIC regions across Western Australia, between 40 and 60% of children in 2000s reported parents and grandparents, sorry, I get very upset, being forcibly removed from family and country. If that's not a stolen generation, I don't know what the fuck it is. But anyway, excuse me, I'm 77 and I'm allowed to swear apparently. But and the rest of that data showed very clearly, in comparing those children who gave a history of forced removal compared with those that did not, that the effects were not just in the first, second and third, but even into the fourth generation. And they were things like more mental health problems, more substance abuse, more gambling, birth weight was lower, all of these things. Third and fourth generation effects of stolen generation. Well, because of my research about development, of course that would be the case. But I am sick of people saying, oh, get over it. You know, it was in the past. you can't get over something as traumatic as that. And if we had had, as a population, the same kind of genocide, the same kind of forced removals, we would have the same sets of problems. It is not an Aboriginal problem that we see in Australia today. It's a problem of colonisation and marginalisation and genocide. So that's my first answer to that. But the two main reasons why governments have not improved the gap are twofold. The first is the groups of projects that have been implemented by, you might say, Marcia, the bureaucrats who think kindly and so on. I doubt it, but anyway, that the programs that in fact cost a huge amount of money, no consultation with Aboriginal people, and do harm. And the best example of that is the Northern Territory intervention, which John Howard introduced in response to the Little Children Are Sacred report, and to reduce child sexual abuse. It was a very punitive intervention. It used the military. It went in with enormous expense to damage self-esteem and the ability of any Aboriginal families to themselves any problems they were in. And not a lot of people know. We've got a lot of data, a lot of evidence to show that child sexual abuse went up every year after that intervention. Now, that's anguishing to everybody. Where are the government programs being evaluated? The second reason why governments failed is that the very successful Aboriginal community-controlled services, of which we have thousands of examples, the latest exciting ones being Birthing on Country, which I'm just so thrilled about. What the government has done basically is either defunded or underfunded them, taken away the capacity, even though with pilot after pilot and evaluation after evaluation, they have shown to be more effective than any white bureaucratic-centred intervention or policy from Canberra or from any of the capital cities. And the best example of that, and again, it's an anguishing one, and I'm sorry to give you these anguishing details, was the defunding by Abbott, Turnbull, Birmingham and Scullion of the 75 Aboriginal community-controlled child and family centres around Australia, which were much more than childcare. They were culturally rich, they were employment for mothers, art, culture, going out on country, hearing testing, health, making kids ready for school, and they were dramatically successful. I'm talking about Bibbert Willem in Victoria, June Oscar's program in the Fitzroy Valley, all the ones that Snake have supported all these years. Now, in 2015, we went to see Birmingham and Scullion with Snake to try and reverse this decision, because we had all the data to show how important early childhood was. Pregnancy and childhood are the most important determinants of your life's ability to participate and to be a person. And here they were cutting the lifeline. And they, in fact, one of the politicians turned to me and said, "Fiona, they're only 3% of the population," which devastated me. And so what they're now seeing is people going to some of these communities and saying, why are all these kids going off the rails? And the very reasons that they could be on the rails is what was defunded by the coalition all those years ago. So these are the damaging things that are being put on top of the damage that's already been done by colonisation and genocide. So you can understand my anguish when I've got all these data and I've got all these studies to show that when Aboriginal people are given the chance to say what's going to be appropriate for them and do it in a way which is so culturally beautiful, that's why I'm so anguished about this whole area of neglect. I don't actually understand it, Marcia. You said, it might be that people are well-meaning, but I just cannot understand why intelligent people don't understand the pathways that we could be enhancing with the proper services funded properly.
So let me go back just a step there, Fiona. I'll ask you two questions. The first, because we lost some internet connection.
Oh, I'm so sorry.
That's all right. It's not your fault. You said that the most anguishing government policy was the Northern Territory emergency intervention. Will you explain that again, please?
Sure, absolutely. We've got a storm here in Perth, which might be responsible for some of the internet stuff. But anyway, The Northern Territory intervention was set up in response to the Little Children Are Sacred report, which was about child sexual abuse in the Northern Territory. And it was set up in 2007 by John Howard to try and reduce this child sexual abuse. It was extremely punitive, extremely expensive. It was based on a military intervention. It had very little, no Aboriginal consultation, no voice to say we don't want this, or this is a way we could do it much better. But anguishingly, every year after that intervention, child sexual abuse went up in the Northern Territory. We've got quite a lot of data to show that, both from AIHW and from Sven Svilburn and others. So that, for me, it also resulted, of course, in loss of self-esteem amongst Aboriginal people and contributed to mental health problems.
Okay, and secondly, you went to Birmingham and Scullion with Snake.
Yes.
Now, tell us, Snake is the Secretariat.
Oh, yes.
Okay, so spell all that out for us and explain for the listener Snake and your partnership with them.
Okay. At Snake are the Secretariat for National Aboriginal and Islanders Childcare. They're the ones who are pushing and advocating for the early childhood services, which all of the research all around the world has shown to be the most effective way of improving your whole life chances. If you have a good pregnancy and a very good early childhood, it can overcome the intergenerational trauma. It can provide kids that are ready for school. It means that those children are on a pathway to participation in society. So we've got so much evidence about the early years and how important they are, and have had that information for years. Now, Snake has sponsored and supported many of these Aboriginal community-controlled child and family centres around the nation, and they were funded well from the federal government for many years. In 2015, the Turnbull, Abbott, Scullion and Birmingham decided that they would defund these centres and that they would put childcare funding as a payment to parents so they could access private childcare, which is really about white women getting back to work, actually. And it didn't suit the kind of environments that were so beautifully provided by these Aboriginal community-controlled centres, which were culturally appropriate, language, going out on country, hearing, health, immunisation. I mean, everything that was going to get that child on a good pathway. To defund 75 of these centres in one fell swoop was absolutely disastrous. And we went to Birmingham and Scullion to try and make the case, to use all the data we had to make the case of why these were so important for the lives of Aboriginal children in particular. And Birmingham turned to me and said, Fiona, they're only 3% of the population, which I was devastated about. And I said to him, yes, Minister, but, you know, this is life and death for these people. And I really believe that early childhood is so vital. So that was anguishing. And now, of course, you can go around to these communities and people saying, well, why are these kids all going off the rails? Why are they hooning around in stolen cars? Well, you know, we could have stopped that if we hadn't defunded those centres. I hope that's answered that properly.
So
Definitely.
So it seems to me that the decision that you're talking about there was not really about money or even a concern about, resource provision. What was it about? What would have motivated a decision about that?
And I would love to know. It was $200 million that would have kept those services going. I mean, it was nothing. And so I've asked myself that question again and again. And I hate to say that the only thing I can think of is that they don't bloody care. I mean, it wasn't a financial decision.
No.
It was somehow, you know, maybe they get frightened if Aboriginal people are going to be competent. I don't know. It beats me. But all I know is that I came away from that meeting, I do get upset. I came away from that meeting thinking they don't class Aboriginal people as people.
Yeah.
We were shattered. And now these kids are being shattered. Why do you think so many kids are ending up in juvenile detention? This is, you know, it's costing the state and the Commonwealth so much money. And it's so cost effective to do things with Aboriginal control organisations. So much more cost effective.
And so I take it that this is why you support The Voice, because you believe in making sure that there is a formal way for Aboriginal and Torres Strait Islander people to have a say in matters that affect us.
Absolutely. But it's more than just supporting it, Marcia. The reason it makes me so enthusiastic and excited about it and so anguished if we didn't get it is that I have data to show that it will make such a difference to outcomes. Now, when you've got data like that, and it's really solid data, Marcia, you know the kind of work that we've done over the years with all my Aboriginal colleagues. We've got the best data in the world, actually, on some of this. And so that's why, and also people say, well, how is it going to work? You know, how's people, elite group in Canberra going to reflect what's happening in community? The networks are already there.
Yeah.
If you look at Aboriginal Medical Services with NACCHO having its headquarters in Canberra, the Aboriginal Legal Services, you look at the Birthing on Country network, you know, all you have to do really is tap into these networks. And I think that's so exciting. And it was so evident, and you and I have written about this, with the COVID pandemic, where NACCHO and all of the community-controlled health and other organisations, because it took more than health, you needed to have, you know, nutrition and closing of communities, and you need to have people getting off the streets and getting into good accommodation. Aboriginal people had the best result in the world. In the world. So when they had a voice which was listened to by government, with that network of services across the nation, with partnerships between the Aboriginal controlled sector and governments, not just state, territory, but local, as well as federal. When they had that voice, it was remarkable. And I don't know why more people aren't swayed by that argument, that when you, I mean, they had 6 times fewer cases than non-Indigenous Australians, whereas the other colonised Aboriginal communities around the world were decimated by COVID. Decimated. Mm. But, you know, we saved the elders. that it was, you know, I still am in awe of how they did this.
Yeah, you're right. It was actually, I think it was almost, if I'm correct, about 18 months before a single Indigenous Australian died of COVID.
Yeah, and the reason they actually died was because they lost their voice. They opened the communities too soon, and Scott Morrison stuffed up the vaccine rollout. Sorry, but that, you know, these things do have evidence and causes.
Mm. And you called this almighty effort by the Indigenous health sector to put in place a pandemic plan to prevent deaths and hospitalisations, in our article, a dramatic reversal of the gap.
Exactly. It was. I mean, perhaps non-Aboriginal Australians don't like the fact that they died more than Aboriginal people. I don't know. We had a difficulty getting it out into the media, Marcia, but the point is that it really was a complete reversal. It wasn't just that they had the same number of cases. They had 6 times fewer. I mean, given that they are such a high-risk population with chronic disease and overcrowding, all those risk factors for getting COVID, and most Aboriginal people don't live in remote communities, you know, they live in cities. They were close to exposure.
Yeah.
And yet they got their act together, they got that voice going. To me, it was a miracle. It was absolutely a miracle.
And certainly our Indigenous health leadership played an extraordinary role. But I think too, and we didn't have time to write about this in the article in the International Journal, but I think our culture played a big role, because I can remember us all getting on the phone to people all around the country saying, quick, translate these public hygiene messages into your languages and make sure that people are looking after the old folk, keeping their distance, wearing masks, long before even the World Health Organization had declared a pandemic. Our wonderful culture kicked in.
That's absolutely true. And I think you see what happened. We have all these incredibly well-trained Aboriginal doctors, public health people, health professionals now. There's no excuse. I mean, they really are a very competent group of people, but also they had remembered the H1N1 2009 flu pandemic, where they did very badly and they didn't have a place at the table. And but what was so fantastic about this campaign was how holistic it was. So, yes, it was absolutely based on the way that Aboriginal people think about their world. And so when I saw some of the health ads and that they're taking the health literacy, they were fantastic. They were much better than any of the non-Indigenous health messages put out. I did a series of boring adverts on the COVID thing for the West Australian government, but the ones that were done by the Aboriginal people and translated into language and using celebrities, Mary G from the Kimberley, all these sort of things, they were fabulous, and they were much more expressive. They had people coughing and droplets going everywhere, and they were extremely effective. And that, I think, that's just one example of the way they got their act together.
And also, Aboriginal lands were closed off to outsiders long before the states even contemplated closing their borders, and before major pandemic measures were in place. And so remote Aboriginal populations isolated themselves and they are the most vulnerable populations and the poorest. With the most horrific statistics across all social indicators. So,
but what was so wonderful about that, Marcia, was they closed the borders and isolated themselves, and they wanted to protect themselves. But when you close a community, you've still got to get food. You've got to have health. You've got to have your pharmaceutical, because many of them are in dialysis. They're on lots of drugs. They have chronic disease. They need food. They need care. They have old people. I mean, how did they manage to do it? It's extraordinary. They didn't have any cases from remote communities until the end of 2021. Not one.
And
but they were still living and breathing and getting all the services they needed. I know it was telehealth and all of those things. That was organised by the communities in partnership, of course, and they shared this, as you said, all across the nation. And I just dips my lid. I really do.
I'm glad that you've raised the pandemic, actually, because it's reminding me of how people felt at that time and treated each other. And my sense of Australia in 2020 and 2021 was that when presented with a cataclysmic crisis, Australians are exceptionally good people who are very, very good to each other and look after each other. And I'd like to remember what that feels like, actually. I mean, I can remember having discussions with Marcia just about neighbours in your street who were just leaving food at your doorstep and everything, and making sure that you were okay because you had no immediate family within a 5-kilometre radius. And this was an overwhelming phenomenon for us to actually see the goodness of people.
It's actually very reminiscent of what an Aboriginal cultural approach is, that you don't care about yourself. What's important for you as an Indigenous person is the community that you're with and your family. And those relationships drive so many decisions. But we were on the health report, Donna Archie and I were interviewed by Norman Swan, and he asked Donna to describe for the listeners what an Aboriginal medical service looked like. And she described it and described the holistic approaches. And Norman said, gee, we'd all like a health service like that. Now, that's sort of the point. That's what I'm so excited about this, because we now need to learn from Aboriginal ways of doing how to better run our own services. And did you know that the Launceston Aboriginal Medical Service has better outcomes for people with chronic disease than any GP practice in Launceston? That's just been, and I know that the Broome Aboriginal Medical Service has about 60% Aboriginal clients and 40% non-Aboriginal clients, because it's the best service in town. So there are a lot of things ways, I keep on talking about sort of Aboriginal ways of doing, but Aboriginal ways of organising their approaches to the wicked problems facing us in society, everything from the way we're mishandling our climate and our environment, all these things, but our health, our well-being, our justice, all these things. If we could follow more an Aboriginal way of doing, we would be far better off. And I hope it's not too late. I don't think it is for birthing. I don't think it is for health services. But it'd be great if we could get a bit more of this into our own rather selfish, narcissistic kind of exploiting white ways of doing things on this planet. But anyway, perhaps I'm being a bit idealistic here, but I do believe that we have so much to learn.
I think for the listener, it might be a good idea if we went back to explain your use of the term genocide. So I'll just provide my own understanding. When the late Sir Ronald Wilson and Michael Dodson took on the Human Rights Commission inquiry into the forced removal of Aboriginal children, they interviewed victims all over the country and also spoke to people from the institutions that had taken the children, and they went through the records of the state governments. And with respect to Western Australia, especially the decisions of A.O. Neville, their finding was a finding of genocide under the Genocide Convention, because A.O. Neville had instituted a systematic attempt to destroy Aboriginal culture and society by removing the children. Am I correct in that understanding?
Absolutely. And if you look at the 1933 report from the Adelaide Conference, where all of the protectors, so-called protectors of Aborigines, were meeting, A.O. Neville actually clearly stated that that was the aim of the policy of removing children. That they were going to leave the full blood, as he called them, Aboriginal people to die, because that's what was going to happen to them. But any of the children who had, were half caste or quadroons and all these awful terms that were used to describe children of mixed race, would be taken, and they would have their Aboriginality bred out of them. So they would be forced to go into these. Many of these institutions were brutal. They didn't educate much, and many of them, as you know, were the children were abused both physically and sexually, and that kind of damage lasts a lifetime and goes on to the next generation. And so what the aim was there was to break down the culture completely. So you weren't allowed to be with your siblings, you weren't allowed to speak language, you weren't allowed to be in contact with your family, you were told your family didn't want you, and these children often didn't know where they came from, and they didn't know who their relatives were. And it didn't strike me until I went out on country many, many years ago with Geoffrey Stokes, when he was explaining in detail the kinship relationships to me, and it suddenly hit me what a stolen generation kid might be going through. If you don't know who you are, then who do you know you can interact with? Who do you know you can marry? You could be breaking a law, an old law that goes back for so many generations. And that made me so upset. But that was the aim. The aim was actually, and at the end, his quote was something like, so that in 2 or 3 generations, there would be no evidence that there had been Aboriginal people in Australia. So it was an absolute policy of his. Mm.
And so in many ways, the renaissance of Aboriginal culture in our services, such as our Aboriginal medical services and our community organisations, is very much a survival tactic, but more than that, it's a way to deal with the trauma of those policies. And you've seen a lot of evidence of this, and you have collected evidence about this. So describe for us the kinds of holistic interventions that you talk about that Aboriginal medical services do so well, and why they work as well as they do, whereas imposed policies like the Northern Territory Emergency Intervention do not.
Oh, yeah, that's exactly right. And I just want to say that what is amazing to me is that they were not bred out. You have survived. And even some of the Aboriginal knowledge, the grandmother's ways of birthing, the understanding, that survived. It survived this incredible attempt to eradicate you. Now, to me, that's the most wonderful, amazing thing. And I think what we call it revitalisation and bringing back the ways of the elders. But how come that they still had it? And you didn't necessarily use anthropologists, although that some of them have been helpful to get those knowledges back. But on the whole, this is oral history coming back through the elders, and I just think it's amazing. What I love about this is how it's changed my view, A, of how I research health and well-being, and B, the way that services could be run to be effective for not just Aboriginal people, but for everybody. And it is about a totally different system, this holistic Aboriginal approach to how to live. So that instead of just with health services, Marcia, you see the Western health services, they diagnose you with diabetes and they treat you for diabetes. You diagnose you with schizophrenia and they treat you for schizophrenia. But in the Aboriginal way of doing, you have a family living in a community, and there are a whole lot of factors that are important in the health and well-being of that family and community that are much more important than a singular diagnosis with a singular treatment. So what's exciting for me is that the Aboriginal medical services, the birthing services, the other services with which I'm associated, not so much here in justice, but I hope the juvenile justice services are going to start becoming more holistic very soon. But what happens is that the trusting Aboriginal ways of doing things are the ones that are controlling the services that are offered to Aboriginal people. Because you have to understand, and I know you do, but your listeners have to understand, that when you have had a genocide like this, would you trust the departments that took your children away? Would you trust the health departments that killed your child and wouldn't give it treatment? I mean, the lack of trust in the mainstream services is very profound and very deep. It's there in child protection, it's there in health, it's there in birthing, and coupled with the fact that it's this historical trauma is also the racism that still exists today in those services. So, you know, it's a double whammy. So what's so lovely is that the Aboriginal control of the services is not just about providing Aboriginal ways of birthing and Aboriginal ways of holistic medical care and so on. It's married with the best of Western medicine, because in ancient times, you didn't have diabetes and STDs, and you don't overweight, and you didn't have heart disease and rheumatic heart disease and high blood pressure and strokes, and you didn't have gambling, you didn't have mental health problems. So those diseases of colonisation have to also be part of these new Aboriginal ways of running services. And the exciting thing is that's what's happening. And it will only happen further if we have a voice in Canberra saying these are the services that need to be funded, and they need to be funded this way because this is the way we're going to make a difference to the outcomes for Aboriginal people. So I'm so excited about this. But, you know, it's interesting that it's not being run by people like me. It's being run by the Aboriginal health professionals and the Aboriginal people who know what has to happen, but they know they also have to have the mainstream service medicines and other activities to help people who are really very ill. So it's a wonderful marriage of coming together, which really is about what the Uluru Statement's all about. We can walk together. But the reason why I'm so excited is this is really pragmatically important. I've written a little article which says why the voice is a cost effective, you know, why it's the best for economically as well as humanely and everything else. Because in fact, it's going to save you a lot of money. It's going to save our taxpayers' money hugely if we get this right and we really get going on this. I'm very excited about the way that these holistic services are married with the kinds of treatments that they need, but it's got to be controlled by Aboriginal people, or Aboriginal families won't trust the services, and rightly so.
Fiona,
I hope that's a reasonable answer to that.
It's great, thank you. Fiona, there's so much about what you've said there that we probably need to regroup at a later date and drill down on, and particularly your journey with learning about and through Indigenous knowledge as your own research networks and approaches have developed over the years. But just to reflect and summarise what I'm hearing and what you're saying, we've had approaches not only in the ancient distant past, but recently within living memory that have worked and worked quite well. And because of, I guess, lack of political support and the stability of that, they haven't continued. The other thing I think I'm hearing in what you're saying is that there is a lot of scepticism amongst some people in the voting population of Australia heading into the referendum that even if the Yes campaign is successful, it won't make a tangible difference. What you're saying is that, of course, it will, because we know that past models that have been supported through previous iterations of government have actually worked really well, and they've streamlined things and economised the public spend. And of course, beyond that, none of that's really important because, of course, it's just the right thing to do. I just wondered, for people who are still deciding how to feel about the referendum that we're about to face, what you would say to them in terms of the tangible deliverables of supporting the Yes campaign.
Well, I think they have to understand that this will be it is a pragmatic as well as a humane solution to the issues and problems. The previous services that were shown to be so effective with Aboriginal control have been defunded or underfunded or not built capacity, and therefore it sounds as if all this money's gone into Aboriginal health and Aboriginal services and it hasn't worked, and of course the blame is put onto Aboriginal people for it not working. But in fact, a lot of those services that were funded by government were not Aboriginal controlled services that were going to be effective. They were going to be ineffective from the beginning because they weren't understanding of the context in which people are living, what we now call the lived experience. And everyone's now saying, we've got to have the lived experience so we know how to put services out there. But this is what this is all about. So I want to say to these people, I'm really excited about what this voice is going to do, not just for First Nations health and wellbeing and those pathways into juvenile justice and all those things that we know will make a difference, but we are going to be so proud as a nation that we have made this decision and supported this amazing group of people. I am amazed at the survival, but I'm also amazed at the lack of violence compared with African Americans, for example. All I get from my Aboriginal colleagues and friends is incredible generosity and wanting to share. Share this information, share this knowledge.